Thank you for joining the Doctor Whisperer. I am your host, Sharon Feckety, and I am happy to bring you a show where we talk about the business of medicine. I hope that you enjoy it. Please feel free to share, subscribe, and pass it on. Enjoy the show. Hello, everybody, and welcome to the show. I'm very excited to bring you today Dr. Katie Rizzo, who is the Chief Medical Officer of TMS Advantage and Advantage Mental Health. There are many more chiefs and CEOs and DOs behind her name. Just know she's a super smart woman. That's very important for you all to know. And we're going to talk about my favorite thing, which is integrative psychiatry and all things mental health. So welcome to the show.
Thank you, Sharon. I appreciate you having me on.
Thank you so much. So I was introduced to you through TMS Advantage. We are so excited to partner with your organization, and you will hear the commercial in the mid-roll and at the end about this wonderful organization that you have been a part of for a while. And I'd like to really just get started because I don't think a lot of people understand the benefits of having someone like yourself as somebody who has a great understanding of integrative psychiatry. So can you give me just a little background of what originally got you interested in integrative psychiatry?
Of course. So going through medical school, I really thought I wanted to do primary care, take a more internal medicine approach. And I had never thought about psychiatry until our third year of medical school. As all medical schools, they require at least 1 or 2 psychiatry clerkships where you actually sit in, meet with patients, sit with a psychiatrist, and really learn the ins and outs and basic diagnostic and treatment criteria. So on my first day, I remember going in thinking, it's an outpatient setting. This is just something else I have to check off the list for medical school in order to graduate. Didn't expect I would fall in love first day. What drew me was the fact that you could develop such an emotional and intimate connection with someone without even touching them at all, no physical exam. It was really just all about their story and how you could help them and lead them in the right direction. And I thought that was very unique because all specialties, you'll see psychiatry in everything from OB-GYN to primary care, to even your specialties. However, it's the only specialty that you really are sitting down for the whole 20 or 30 minutes or whatever you have with the patient and really getting to talk to them the entire time and not distracted by a ton of other lab values and things you have to check off on your EMR and criteria that have to be met for insurance purposes. So that's really what drew me. I took more of an integrative approach with it because I did graduate from an osteopathic medical school. I've always liked looking at the body as a compilation of mind, body, soul. You really can't take just one and focus on that because if there is issues in other areas, it's going to bleed into and prevent what you're doing to target the one. You really got to target all 3. And that is the basic principle of osteopathic medicine, is that everything is interconnected. So it was really important for me not to segregate psychiatry and say, okay, we're just looking at the mental health aspects, forget all of the medical things that could be contributing or your physical issues or lifestyle factors. I really wanted to make sure that we were targeting every single aspect, even if I wasn't the specialist in all of those areas.
Mm-hmm. Well, sometimes when I'm speaking to somebody like you, I forget I'm on a podcast show and that I then have to follow up with a question because I'm like, yes, tell me more. I love this. Okay. So can you, for the audience, I'm the Doctor Whisperer too. That's one of my businesses. So I've been working in medical for over 20 years. I started my career with Eastern Western medicine. So I was very, very lucky to have started out in medicine with an alternative side and then, more neurology, orthopedics. And I feel so blessed to have started my career that way in New York. And then here, just always been very open to, there's so much more to a human being, right? Than just, something going on with their mental health, or something going on with them physically. Like, everything is connected. So I'm just really happy that you are a part of this wonderful organization, this wonderful clinic of TMS Advantage. So can you just kind of separate what some of the misnomers might be about what a DO is and what an MD is?
Yeah, of course. So DOs and MDs have the same exact medical training. They're just different licensing boards. In osteopathic medical school, you get an additional training in what's called osteopathic manipulative medicine. And it is hands-on manipulation of various parts of the body in order to, it's the belief of like the fascia is connected, one part of the body is connected to every other part. And that's why you really have to get to the root and treat everything, and not just focus on one. That's the main difference. We take all the same exams. You have to do all the same clinical rotations, all the same academics. However, it's really focused on the whole person, and then that added benefit of the osteopathic manipulative medicine.
Love it. Thank you for explaining that. So why do you think it's important to incorporate an Eastern Western approach to mental health?
So I think with the stigma of mental health for so long and so many decades of people like, oh, I don't look at the treatment options that are out there. They're either medications that zonk people, or you have too many side effects, or you become someone else, you're emotionally numbed, you're not yourself, or something like electroconvulsive therapy, which is an amazing treatment for some patients. But sadly, the way it's been portrayed over the decades is it's very like barbaric, right? So people have that image when coming into mental health. So that's why I wanted to make it more welcoming and more open for the patients that come in, so they don't sit here and think, oh, I'm automatically going to give them a medication, prescribe them this, or have them go do something like a neurotherapy like TMS or ECT. I want them to know that I will meet them where they are. And if they want to start at the foundation, which is just maybe looking at lifestyle factors or how to deal with acute psychosocial stressors that are going on, we can definitely do that. Coming to a psychiatrist does not automatically mean you're leaving with a prescription, at least in my case. So
right. At least in your case.
Yes. And I know there for years and years, that's what psychiatry has been viewed as, is just pill pushers, right? But I really try to meet the patient where they want to start, right? So if patients have come into me and they say, I've done all these lifestyle factors and I'm still feeling depressed or anxious, I've exercised, I met with a nutritionist, or I just changed my diet on my own, and I'm still having these symptoms, then I'm like, okay, these are our next options. I have other patients that come to me and all they've done is the medication route or maybe therapy route. And I go, okay, well, maybe we need to take a look at this nutrition, your exercise, supplementations that could help you, things of that nature. So I tend to see where I'm getting either like one extreme or the other with patients. So I feel like that's why the integration of the Eastern and Western has been so great, because there's patients that have come to me and said, oh, I've tried every medication under the sun, I don't know what to do. And then I look at something like, okay, well, have you tried something more complementary like acupuncture, for instance? And so really being able to guide them into what they're missing out of the two Eastern Western has been helpful in creating that holistic approach and really getting patients the quality of care and the results that they want to see.
I love it. So, I was told myself, I got sober at 21. God willing, I'll be celebrating 28 years sober next month. And
congratulations.
Thank you. But I was very depressed each time I got sober. And I think this is very common. I think a lot of addicts and alcoholics, we don't have a substance anymore to mask the pain. So we turn to something. Some people it's food, some people it's work. So some people it's gambling. There are many ways that we can numb ourselves. And I was put on a medication in my first year of recovery when I was 21. But I was also seeing a therapist, my dad's EAP counselor, employee assistance program. He worked at New York Hospital. And I also had recovery. So I always share this because I really felt like I had like a team around me. It wasn't just one thing. And then, my therapist at the time had told me that we were going to do this together. And we all as a team worked, and I was weaned off, and I haven't taken any medication since. I share this story a lot because I think that even myself, I've changed a lot in my thought process about what medication is and what's good for me and what's good for everybody else. I myself was told that I had a chemical imbalance in my body and that I needed to have this medication in order to kind of even me out. I never questioned it. I just believed it because, listen, anything was better than wanting to die, in my opinion. We interrupt this awesome podcast to share with you about our sponsor, TIE Technology. TIE Technology was founded with the thought that every customer deserves exceptional customer services. So if you know of any company that has a phone system where the auto attendant doesn't really sound good, you press 1 and you think you're going to go to a live person, but you end up with a broken recording, it's probably time that you call TIE Technology. And if you mention this podcast, you will get the first 3 months for free. So make sure you mention the Dr. Whisperer podcast show. Check them out. But today, now, when I reflect, and I've listened and read so many books and been educated by so many wonderful physicians such as yourself, that, I was definitely traumatized, and there was a lot that had to be worked out. And because I had these other modalities, right, I had all of these other resources, recovery, exercise, nutrition, I was encouraged to go out into nature, that I think that all of that helped. And I'm not always like, yes, it was a chemical imbalance. So this is kind of a doozy that I'm throwing at you, but I just wonder what your opinion is of that, because I think that story was told to me. So I accepted it and I believed it and I ran with it. Today, I don't necessarily think I had a chemical imbalance. I think that I was traumatized and I just needed to move through that with a therapist.
So when looking at it and the basis of psychiatry and how much we study pharmacologically, we know that regardless of what caused the depression or anxiety or the symptoms, it can become to a point where they're so severe that it is changing the neurochemical environment in the brain and how those neurons are interacting and talking to each other. I don't think it's fair, though, to say that everyone that comes in necessarily has a chemical imbalance, right? Because sometimes we know that it's just adjustment or psychosocial stressors that are causing that, right? And it hasn't gotten to that point where someone is so experiencing so severe of symptoms that those neurochemicals are actually changing. But we know if we can help them to cope with the stressor or even remove the stressor, which a lot of times in life we can't do that, that people are able to kind of pull out of that and start to feel better. There are people, though, that for genetics, biologic reasons, like you're a unique set of genes from 2 individuals, your neurotransmitters are going to work different than mine. That sometimes even aside from these life stressors, people do suffer from chemical imbalances, right? And that's where medication is not the only thing that's going to fix that, though. And that's where I think that we have to look at it. There's studies that show that therapy alone can correct those neurochemical imbalances. So we really have to kind of realize that it's not just the pharmacology, and it's not always everyone coming in with, for sure, you have low serotonin levels. Unfortunately, there's no way to really measure that accurately and show what exactly is going on in the brain. We have to kind of assume, but we know that it's not everyone is undergoing a neurochemical imbalance per se. Also, your brain chemistry is always changing, right? As you grow, as you adapt to different situations. So it's kind of, I look at the brain as it's always adapting. So you're always going to have differences in your neurotransmitters, right? But I agree, it can be scary for patients to come in, and if that's what they're told, like, you have a neurochemical imbalance, they start to feel like, well, what's wrong with me, and why do I have this compared to the next person?
Yeah, and I have used this parallel with just the pandemic itself. Like, we've been able to see how the virus has affected so many people differently. The vaccine has affected so many people differently. If that's not like a showing of we're all individuals as human beings, we have different chemicals and different makeup, and not every treatment is going to work for a friend that might have told you, like, you have to try this, you have to do this. We have to really be so individual about our healing and our treatment. So, so can you share some of the positive outcomes, obviously without some specifics of patients that have come in, that you've seen with TMS?
Yeah, of course. So here, I know that Curran has probably mentioned to you when you spoke with him that we try to take an integrative approach to our TMS, our transcranial magnetic stimulation. We use NeuroStar Advanced TMS Therapy. They're the leading industry leader in TMS machines, to make sure that we're getting patients the most effective treatments every single treatment. But once again, we want to make sure that they're engaged in therapy, they're doing group and individual therapy, they're tracking their sleep, they're tracking their steps, because we find that with that, that's where we're getting the best results. So I've had patients that have come in, the majority of the time. So we try to take this integrative approach because that's where we've seen the greatest results with patients. As for patient success stories, I've had patients that come in for an evaluation for TMS and they haven't gotten out of bed in weeks to months. And that's how severe their symptoms are. And they're to the point where they may have been, some have been suicidal, some have not, but they're to the point where they're like, I don't even see the glimmer of hope or the little light at the end of the tunnel, because I've literally done everything that my other physicians and psychiatrists have told me, whether it be medications, therapies, etc. And I've never found or weren't able to tolerate these treatments for long enough for them to work for me. And that's where I've seen TMS do wonders for patients, because it's so focalized and you don't have those same systemic side effects with patients. As you do with medications. Patients come in and they finally start to feel relief from something that they've never experienced before. And I think it only helps that they're coming in 5 days per week, right? They're getting to interact with our staff. They're getting to interact in group therapy. And I've seen patients literally who have come in and haven't seen the light of day in months. And then by the end of their TMS treatment, they're like, wow, even if I'm not exactly where I want to be, like I can finally see that light again. And I think that that's the most important and most rewarding aspect of offering transcranial magnetic stimulation.
Well, I love that reference. I wrote about this in my book that I used to tell my counselor that I used to go see every Tuesday, that I used to make him repeat to me, if you could just tell me that one day the blinds will open and I'll feel good again. That feeling of having some light come in when there's been so much darkness is so relatable to me. And really that small glimmer of hope really can set somebody on such a wonderful track of progress and recovery from all of these mental health issues that so many people are struggling with today. So how can we encourage more people to realize that it's okay not to be okay, and it's absolutely okay to ask for help?
So I think we start by stopping comparing ourselves and looking at everyone else. It's so hard in this day and age, especially with social media. Everyone is putting their best foot out. And all you see is the good, right? So it's really hard when you're personally struggling with anxiety, depression, or another psychiatric illness or just going through a hard time to see and be like, why can't I cope when everyone else can? So I always recommend to my patients setting boundaries with that and really looking at trying to stay immersed in the real world. So scrolling for hours on end, it's only going to get you in that rabbit hole. Really trying to cleanse yourself from like the news, social media outlets, and limit how much you're participating in those worlds, because it isn't a reality, right? I know that there's been great moves though on TikTok, Instagram, Facebook about trying to get people to come forward when they need help. And I think that's awesome. But I still think that the majority of times people are sitting there and scrolling and seeing the good everywhere else and not realizing like, yes, that person has emotions too. They cry, they're sad. They may be going through a depressive episode as well. So I really think that creating not a bubble for yourself, but really trying to cleanse yourself of some of that and really focus in the present, being mindful and reaching out to your circle, making sure you have a circle of people that you can trust, even if it's a few. That can be family, friends, therapists, psychiatrists, whoever. You just need people on your side, and trying to be open with at least one or two of them, and that could just be the little spark that someone else needs too. If you're open about your mental health journey, that maybe they're going through the same thing and you would have never known.
Yeah. I can't plug this organization more because I really believe that, as I mentioned before, I really had this team. It wasn't just one person helping me through my issues. I had a collaborative effort, and I see that with TMS Advantage and Advantage Mental Health. I really think that it's so important that we have physicians like you that understand that it's not just going to be one thing, and how open you are to extend services somewhere else and suggest other services, because I think we need more of this. I think we're moving in the direction of having better practices such as yours to really just to treat the whole person and understand that everybody is an individual and one thing isn't always going to be the answer, but that also the patient has to make that commitment to do the work, right?
And that's the first step with anything in addiction, mental health, just overall bettering yourself. You have to, no one can make you do something. You have to want this for yourself. And that's why I think, once again, to reiterate, it's so important to meet the patient where they are, right? And if they're not in, even if it's depression and they're not willing to be like, I don't think I'm willing to go to therapy for weeks on, and I just don't think it'll work, then fine, let's start with the basics, back to basics, sleep, exercise, nutrition. I think if we as providers are able to meet them at where they're willing to work, they'll have greater success in the future.
I couldn't agree more. Well, Dr. Rizzo, thank you so much for joining us today. I appreciate all you do to help others.
Thank you, Sharon.
And everything about this practice is going to be on the show notes. So don't text me that I have to see Dr. Rizzo, because I know you're watching and you're like, I have to see her. I know. So look at the show notes, click the website, and get in touch. Thanks so much, Doc.
Thank you.
So don't forget, if you mention that you've seen the show or listened to it on the podcast, mention Thai Technology and you will get 3 months for free. They're the best.